Caution: first, managing piles the right way. When you're on the toilet, take your time and avoid straining during bowel movements. Straining can make piles worse. Elevate your feet with a small stool or footrest while you're on the toilet. This position can help you have more natural and less straining bowel movements. Don't linger on the toilet for too long, and don't force yourself to go if you don't feel the urge. After using the toilet, gently clean the area with moistened toilet paper or baby wipes. If you're overweight, losing some pounds can ease the pressure on your rectal area. Try not to sit or stand for long periods without breaks. Change positions to reduce pressure on your piles. You can consider using over-the-counter creams or ointments for relief from itching and discomfort. Include more fruits, vegetables, whole grains, and beans in your diet. Drink plenty of water throughout the day to prevent constipation and help your digestive system work smoothly. Exercise promotes better blood flow and can help prevent constipation. Check with a healthcare provider before using any medications. Taking warm baths for 15 to 20 minutes a few times a day can help reduce pain and swelling. Fiber helps keep your stools soft, making them easier to pass. If it's hard to get enough fiber from your food, your doctor may suggest fiber supplements. If your symptoms persist or worsen, it's essential to consult a healthcare provider for proper diagnosis and guidance. For more details, contact Dr. Tulips Theodias at 988-613-9999.